Hi, I'm Dr. Kelly Starrett with H-Wave. Oftentimes when we're talking to people about their shoulder pain, we end up having a conversation about strategies where we can engage with more movement so that the body is better able to handle swelling and congestion in that shoulder and bring nutritive blood flow back into that area. The problem with the shoulder is it's actually hard to kind of get the kinds of movement that we'd like. Right? If we're looking at walking, it makes sense. Hey, I try to walk a little bit more. I can get my 8,000 to 10,000 steps. And that system of walking is going to do a lot of loading, but it's also going to do a lot of decongesting, of just the muscle contracting, bringing blood flow in and bringing the waste out. The problem with the shoulder is that it's painful to move, and also it's sort of inefficient for me to be walking and swinging day to day. So one of the things that happens is that when we introduce H-Wave, we're able to get a lot of very targeted movement without having to have lots of motion in the limb. So instead of putting one of our patients or athletes on an assault bike or having them kind of spin their arms all day long, we can get targeted muscle contraction, a pain-free, non-fatiguing muscle contraction in the tissues and associated structures of the shoulder for many, many hours at a time. This does a couple things. One is that we're going to get sort of non-threatening movement into the system. So because the movement is the shoulder is contracting, the brain is perceiving that as motion and movement, and that can really help to de-escalate and desensitize painful structures. Number two is that we know that when we are contracting musculature, we're actually working on sort of normalizing what's going on with those tissue systems. And so we can actually get a ton of blood flow in that system, in this case the shoulder, and by simply getting improved blood flow to some of these sort of systems which can be ischemic and low oxygen and not get a lot of use, and by that muscle contraction pushing the congestion out through the lymphatic system, we oftentimes see massive decreases in pain while we've set up a system where that tissue is now normalizing, but because there's less congestion, we don't have as severe as symptoms. So we're getting movement, which is signaling to the brain it's safe. We're also getting a ton of motion in there, which is doing all the things that we would do with exercise and sort of babysitting the tissues while they're healing up. So in short, we can continue to actually jump rope and walk and do all the things that we should be doing to try to normalize a healthy tissue system. But simultaneously, we can be working on this by pumping this shoulder during off times while I'm at work, while I'm watching TV, while I'm on my commute, or even in the evening when I go to bed. We can get hours and hours of decongestion and improved blood flow, which can help us heal that system more effectively.